Right now, if you get a toothache, you call a dentist, they numb your mouth, and 20 minutes later you're fine. That entire experience, the numbing part especially, is less than 200 years old. For basically all of human history, a toothache meant something between screaming and praying. And the cures people came up with are so much stranger than you're imagining. Let's start in ancient Sumer, around 5000 BC, because they wrote down the first dental diagnosis in human history. And it was wrong. They believed a tiny worm lived inside your tooth, and when it moved around, that's what caused the pain. There's an actual clay tablet, The Legend of the Worm, where the worm begs the gods to let it live inside teeth and gums forever. To treat it, healers would burn henbane seeds and have you inhale the smoke, which sure enough is a mild hallucinogen. Then they'd pack the tooth with a paste of crushed caterpillars and fat, add some honey and oil, and chant a spell over you. And here's the scam part. The burnt seed ash left behind little pale squiggly bits that looked exactly like tiny worms. Healers would show you the worm they just pulled out of your tooth. This belief lasted in multiple cultures all the way until the 1700s. Now, ancient Egypt actually tried to professionalize this. Around 2600 BC, a man named Hesy-Ra became the first person in history with the job title dentist. His tomb literally calls him Great One of the Ivory Cutters. He treated the pharaoh's teeth. But he still had zero anesthesia, and Egyptian toothpaste was made partly from crushed eggshells and ash from ox hooves, which is abrasive enough that it was probably wearing people's enamel down while it cleaned it. Skip ahead to medieval and Renaissance Europe, and dentistry becomes a traveling roadshow. Barbers doubled as surgeons since they already owned sharp blades, and specialist tooth drawers would show up at village fairs with a chair, a pair of pliers, and zero training requirements. Getting your tooth pulled in public was actual entertainment. Crowds would gather to watch, and because there was still no real anesthesia besides alcohol, the tooth drawer would bring musicians. Drums, horns, whatever was loud. Not for atmosphere. To drown out the screaming, here's where the story takes a turn you've probably heard wrong. George Washington is famous for having wooden teeth. He did not have wooden teeth. His dentures were built from hippo and walrus ivory, animal teeth, a lead base, and metal springs to hold it all together. The wood look came later, when the ivory stained and cracked with age. But the more important part, historians want people to actually know. At least 2 sets of Washington's dentures also contained real human teeth, and payment records from Mount Vernon show teeth were purchased from enslaved people on the plantation. We don't know for certain whether that exchange was truly voluntary, given the power an enslaver held over the people he enslaved. It's a far more disturbing detail than a wooden smile, and it's the one history textbooks left out for 200 years. So how did we finally get to the numbing shot you get today? 1846. A Boston dentist named William Morton had been testing ether as a pain reliever. On September 30th, he used it to pull a patient's tooth, and it worked. 2 weeks later, on October 16th, he repeated it in a public surgical theater in front of a room full of doctors, and modern anesthesia was born, live on the spot. The single most important pain relief breakthrough in medical history started because a dentist needed to pull a tooth. So the next time you sit in a dental chair and complain about the noise of the drill, remember what came before it. A worm myth that lasted 3,000 years. A pharaoh's dentist with no painkillers. A traveling showman with pliers and a drummer. And a piece of American history that got quietly sanitized for 2 centuries. You are sitting in the single most painless moment in the entire history of teeth.